Bismillah ar-Rahman ar-Rahim. Assalamu alaikum everybody. I hope you all are doing very well. Today we are going to start to visit websites and visit databases to find the evidence that we're talking about. Remember, we said that as a profession of physical therapy, we are committed to evidence-based practice, and these are the standards that are required to practice physical therapy in the world. The first step we are going to, as you remember, start with the clinical question. I have a patient and I have a question about this patient and I would like to get the answer to that question. So how do I go about finding the answer? The questions that you might have in the clinic can be related to either the anatomy, physiology, pathology of the disease or the problem. I have a question here, for example, what is the pathogenic process of lupus arthritis? For example, if you have a patient with systemic lupus erythematosus and she has problems with her knee, what kind of problem is it? Is it an inflammatory arthritis? Is it an autoimmune arthritis? Is it degenerative arthritis? What is the type of problem that she has? So this is one of the questions that you might have in the clinic. You might have a question about surgical management. For example, which is a better option for anterior cruciate ligament reconstruction, allograft or autograft? So this is another question that the patient might ask you. Is it better that I get a graft from outside or to use my quadriceps tendon or hamstring tendon for the graft? Another question might be related to a diagnostic test. For example, if you have a patient with a shoulder problem, can you use the impingement test to know for sure if the patient has rotator cuff tear? Is this a good test to use? So that is a question that is related to a diagnostic test. I know that I'm talking about diagnosis, and sometimes you feel that physical therapists do not diagnose. We do not diagnose medical conditions, but we can diagnose a PT diagnosis or give a PT diagnosis. The physical therapy diagnosis is the specific impairment or the specific problem that the patient has. So a patient with a knee problem or a shoulder problem doesn't necessarily have a specific diagnosis for physical therapy. So that's what physical therapists do. They give a physical therapy diagnosis. All right, a question can be about the factors which will predict a patient's future health status. So I might have a question about the future of the patient. Is this patient going to get better or going to get worse? So if he is walking slower and slower, is this going to predict his level of disability in the future or not? Is gait velocity something that is important and indicative of the future disability level of the patient? Also, you might have a question about the benefits and risks of an intervention. For example, if you have a patient with a pacemaker, implanted pacemaker, can you use ultrasound on his shoulder? Would this carry any risk in the application? So that is an important question that you might have in the clinic, and you need the answer to that question because you're not sure if it is safe to use ultrasound on a patient with a pacemaker. You also might have a question about outcomes. Remember, outcomes are the end results. So how can I measure the end results? For example, for this question, how can I measure improvement in lumbar facet joint after mobilization? So you did a anterior posterior mobilization, for example, for the facet joints of the lumbar region. How can you know if the patient is getting better or not? What can you measure? So these are questions that might arise in the clinic, and you might want to know the answer to one of these questions of course, quickly, because you don't have all the whole all time of in the world. So how can you go about finding good evidence to answer your question? If you notice these questions, we can actually divide them into two types: a background type or background information. And these are the questions that are related to the anatomy, the physiology, the pathology of the problem. These questions are usually questions asked by either students, new graduates, new interns, new practitioners. Usually an expert or someone who has been in the clinic for many years usually doesn't have a lot of background questions. He usually is very familiar with most conditions, and he will not have background questions. So questions related to how long it's going to take for something to heal, how long, which is a better option for the surgery, what is the pathology of the condition, what are the causes of a condition. Usually expert clinicians have the answers to these types of questions, except if you have a patient, a new patient with a rare syndrome or a rare disease. You might not have the answer to that question, and you might want to search for background information. The other type of questions, let me just tell you where to find the answers to background questions. One approach is to go to a textbook, which is a very dangerous approach, because you really have to look at the date of the textbook. Information is coming out so quickly now. Every day there is new information about all conditions and all diseases, and it is very dangerous to go to an old textbook for information about current conditions. Good places to look is government websites, professional society websites, and patient advocacy website. An excellent source for background information is the Center for Disease Control and Prevention. The CDC is a place that has a lot of information about almost everything. It is, of course, a government website. It gets renewed and updated on continuous basis, so the information is always up to date. So you can trust the CDC for information about any condition. This is the website for the CDC. It has, of course, different sections: disease conditions, healthy living, data statistics. If you want to know any statistics about any disease, you will find it on the CDC website. Another good place to look for answers to background information is the NIH website, the National Institute of Health. The National Institute of Health is another government website, and it has a lot of good information, and of course it's updated on continuous basis, and it will tell you when the last time it was updated on every piece of information. So that's another place to look. Professional societies, and these are the societies that has professionals. For example, for us, it is the American Physical Therapy Association. For the heart specialist, it is the American Heart Association. These websites are also very good websites, very credible, very reputable. So you can use these websites for information as well. If you go into the American Physical Therapy Association, you will find a lot of information for the public, but you will not be able to get into specific informations and do search engines unless you are a member. Most associations are that way. They provide public service on some things, and they provide special service to the members on other things. Patient advocacy groups is another good source for information. And for example, this is a website for breast cancer, and there are so many of them. Down syndrome, many websites for patients to find resources, to understand their condition, to be able to talk to other people with the condition. So patient advocacy websites are good sources as well. Definitely, if you need scientific information, your best bet is to go to the professional societies and the government websites. So background information, easy to find. Again, books can be okay if they are up to date. If they're not up to date, I caution you, because the information can be old, and we can't afford to take old information when it comes to patient treatment and patient health. Foreground questions, that's the other type of questions. So we talked about background questions. Foreground questions are questions that are asked by most of us. If I'm in the clinic and I have a condition, a patient with a condition, and I want to know something that I don't know about the condition. I want to predict in the future what's going to happen. I want to use an outcome measure that I want to compare with another outcome measure. So these are questions that clinicians, even expert clinicians, can have on daily basis in the clinic. So the other section of the questions that we went over are called foreground questions. Questions about the treatment, about the intervention, about the outcome measures. You can ask the question in a simple format, the foreground question, either simple format, or you can ask the question in a comparative format. Remember when we did the question for homework, the PICO? One of the letters, C, was the comparison, trying to compare what you are thinking about with something else. So you are comparing between two things. Remember that the more you're familiar with the tests, the more you're going to be able to compare. If you are still starting, if you are new, probably your question will be more of a simple one. Let's go over some of these. For example, if you have a question about a diagnostic test and you are thinking of using the NIRS test. Of course, NIRS test is a test for the shoulder. I'm sure all of you are probably familiar with it. So your question can be, will the NIRS test help me to detect rotator cuff impingement in a 35-year-old male tennis player with shoulder pain? So you have a tennis player. He has shoulder pain. He is a man. He is 35-year-old. And you are thinking of using the NIRS test. If you use the NIRS test and it is positive, would that mean that the patient has rotator cuff impingement? So that's a simple question. If you are an expert and a more experienced clinician, your question might be, is the NIRS test more accurate than the lift-off test, which is another test for the shoulder, for detecting rotator cuff impingement in a 35-year-old male tennis player with shoulder pain? So in here, the question is comparing between two things, the NIRS test and the lift-off test. So you want to look for evidence to tell you which test is better in detecting rotator cuff impingement. Okay? For example, if we take intervention, if I'm thinking of doing PNF on this patient who is a 7-year-old child with right hemiparesis due to stroke, is proprioceptive neuromuscular facilitation, or PNF, an effective treatment technique to restore core muscle strength or trunk strength stability in this child? So that's the simple question. Or you can ask a comparative question: is PNF better than neurodevelopmental technique or the NDT for restoring core trunk stability in this child? Again, your question could be related to diagnostic tests, to clinical measures, prognostic factors, intervention, clinical prediction, outcomes, or self-report outcome measures. Let me talk about self-report outcome measures because they are important and sometimes we don't pay attention to them. We use self-report outcome measures, and from the name, self-report means that the patient himself reports the results. So you're not measuring anything. You are giving the patient questions and the patient is answering the questions. So that is self-report outcome measures. By the way, these questions are not haphazardly asked. These questions are usually tools that we use, and these tools are tested for validity, reliability, and sensitivity and specificity and all of that. So self-report is commonly done in cases of depression. If you want to know if the patient has depression or not, there is a geriatric depression scale and there is a depression scale for independence in activities of daily living, in perception of health, in pain perception, and so on. So there are many tools that are published that can be used for self-report. Let's look at this question. Will the Minnesota Living with Heart Failure Questionnaire, so this is a tool, it's called the Minnesota Living with Heart Failure Questionnaire. So these are a group of questions that are given this name, and these questions are supposed to detect a change following rehabilitation in an 82-year-old woman with chronic congestive heart failure. So my question is, if I use this tool, is it going to detect the change in her rehabilitation? I can also have a comparative question because there are so many tools. So the Minnesota is one, and this is another one called the Chronic Heart Failure Questionnaire, and we can compare between the two. So maybe you are in the clinic, you want the patient, your patient had heart failure, you want to know about the sensitivity of this tool to detect a change, and you're wondering if you should use the Minnesota one or you should use the chronic heart failure one. So this is a question that you can find the answer to by searching for the evidence. Again, foreground questions can be about the diagnostic tests, the clinical measurements, or the assessment, the prognostic factors, intervention, or outcome measures. Remember, outcome measures are the end results. We can measure it ourselves with the goniometer, with manual muscle test, with isokinetic machine, with anything, or it can be also self-report. Now we know how to ask the question, and now we know how to make the question specific, and we now are ready to explore the electronic databases for the answer. Remember, we want evidence-based databases. We don't want any information on the internet, right? We want to look for the highest quality of evidence available. Highest quality means really primary sources, because information could be in a primary source or in a secondary source. Primary source, we're talking about the original research report that is published in peer-reviewed journals. So this is the original study. The people who did the study published the study. They're talking about their own study, and their study is published in a peer-reviewed journal. Remember, peer-reviewed journals are journals that have editors who are experts in the subject area. So if you want to publish a paper on, for example, Down syndrome, then your paper will be reviewed by experts who are dealing with this condition, and they will decide if your study is good enough to be published or not good enough to be published, or they can suggest that you change some things so they can publish your paper. And we have secondary sources. Secondary sources means that somebody is reporting on this primary source. So somebody read the article and is talking about it. So that is a secondary source. Of course, books are secondary sources because the person who wrote the book is not the person who did the study. The person who wrote the book read the study and is telling you about the study. Review papers, and I'm not talking about systematic reviews, I'm talking about general review papers, are also secondary sources because, again, the reviewer is reviewing papers or studies that have been done by other people. And of course, all the professional websites will have secondary information because it's reporting on research that have been done by a primary source. Okay? So when we are looking for evidence, we are always targeting primary sources or journals. We're targeting the original research. There are 5 main databases. Of course, now there are so many databases that we can look for, but there are 5 major ones that are used for physical therapy. The first one is PubMed, or Medline, the old name. Now it's called PubMed. The second one is Physiotherapy Evidence Database, or PEDRO. The third one is called the Cumulative Index to Nursing and Allied Health Literature, or CINAHL. National Guidelines Clearinghouse, Hooked on Evidence, and we'll talk about that, and the Cochrane Library. These are very important databases that we can use to find answers to our questions. There are other sources like the Google Scholar, the Yahoo Education sources, and these are good search engines for general topics. They have some good information, but they are not really specific to medicine, and they're not specific to physical therapy. And they list the papers according to how many times the paper was cited, so it might give you a misinterpretation of the importance of the paper because many people talked about it and it's not necessarily the best paper. Of course, the indexing in Google Scholar or Yahoo is not as rigorous as the other databases. So these websites are okay for general information, but if you want a specific clinical question, these might not be the best source for information. So the first database we are going to talk about is the PubMed database. The PubMed database is the United States National Library of Medicine. So it is a very, very old library. It is dating back to the late 1800s. The electronic version of PubMed contains over 24 million citations. So 24 million papers and research articles are published on PubMed. And it really started way, way back in the 1950s. PubMed is excellent because it is free for the public, so you don't have to pay subscription. It is very, very comprehensive, has a lot of information. It also contains links to online journals that provide full text. So it will not just give you the citation, it will also give you the full text of some of the articles. It has rigorous standards, so everything that is cited in PubMed is usually very high quality research because they will not just publish anything or index anything. The challenge with the PubMed that it is so huge, it can give you results in the thousands sometimes. It is very complex. You need to learn how to search it. It excludes some of our physical therapy journals and allied health journals like nursing, speech therapy, and so on because it has very, very rigorous indexing standards. So it will not just list any journal. So some of the journals are not listed in PubMed. If you go to the PubMed homepage, this is the PubMed homepage, this is the URL, you will see that it has many options, and we'll talk about these options. The inclination for searching, of course, here you put your search terms and you search, and you're searching PubMed. The inclination is to just write terms in here and search it. And this, for example, let's work on this example. Of course, the search terms, we all know keywords, so you will find keywords. So if your question, for example, I have a question here, does age and the prior functional status predict discharge to home following inpatient rehabilitation for a fractured hip in a 92-year-old woman? So I am in the clinic. I have a patient who is 92-year-old woman, and I am trying to decide if she should go home after fractured hip, after they fix the fracture. Should she go home, or should she go to a nursing home, or someone must be with her? Can I predict from her age and prior functional status, can I predict if she's going to be okay at home or not okay at home? So if I want to search for an answer to this question, what are the keywords? Age, functional status, predict, discharge, home, inpatient, rehabilitation, fracture, hip, and woman. All of these are possible keywords. I'm sure you can see the problem that we're getting into. We have too many keywords. We can also increase this number of keywords by using terms that reflect the concept of the question. So instead of functional status, I can say function. And instead of 92-year-old woman, I can say elderly or old. So more words. Finally, some of the words may be combined into phrases. I can ask for a phrase. For example, inpatient rehabilitation, hip fracture. So I can look for fracture and for hip, or I can look for hip fracture to narrow down the search. Well, you can see that if I'm going to use all of these keywords, I will end up with a humongous number of citations. If I use general words, for example, like if I have a patient with rheumatoid arthritis and I want to see the effective exercise on arthritis, one of the things that I can use to narrow down my search or expand my search are called Boolean operators. Boolean operators are connectors between words. Like, for example, the word and, or not. If I say arthritis and exercise, that means, and if you notice, and is written in all caps. So arthritis and exercise will look for all articles that has the two terms. So it will not give me the articles that has only exercise or only arthritis. If I say rheumatoid arthritis or degenerative arthritis, then it will give me all the articles that has either degenerative arthritis or rheumatoid arthritis. If I say not, for example, I want rheumatoid arthritis, not children, then it means that it's going to look for only the studies that are done in adults, not children. So as you can see, and will expand, and will narrow down the search, or will expand the search. So when I say and, it will narrow the search to the terms that I'm using with the and. If I say or, it will expand the search. If I say not, it will narrow down the search. These Boolean operators are usually in every single database rules and can be recognized by most databases. So these are important to remember. Okay. So if we say arthritis and exercise, as you can see, I ended up with 2,398 citations. 2,398 articles talked about arthritis and exercise. Who can do that? Who can review this number of citations? So using keywords here didn't really help me much because they are too general. So if I go to PubMed and enter arthritis and exercise, then I will end up with a lot of citations that I can't sift through. How about if I say rheumatoid arthritis and exercise? Well, if I do that, you can see that I ended up with 447 citations, which is still a huge number of articles. These are called citations, by the way. The citation means you have the title of the study, the authors, and it will have all the information about, if I click on it, it will have all the information about the journal and about the authors. So that's a citation. So again, 447, that's a lot of citations. Again, what is a citation? It is the information about the article, the names of the authors, the title of the paper, the title of the journal, the volume, the pages, the date, and the publisher. So that is a citation. So I hope that you have seen that looking for keywords, just general keywords, is going to really end up with a huge number of citations that you will not be able to handle, and you're not going to be able to find the answer to your question. That's why PubMed has a different way of finding citations, which is called the MESH headings, or medical subject headings. Medical subject headings are words that we use to index the article. So if you submit an article to be indexed in PubMed, they will put your article using specific words that are called mesh words, and these are usually keywords. It's really good because it provides a consistent way to retrieve the information. So every time you enter these words, you will find the article. There is no way that you will lose the article or not see it if you use the mesh words. It will enable you to use different terminology for the same concept. For example, old, elderly, older adults, etc. So it will give you a chance to include all the articles that are talking about, for example, in this case, old people. So if you use the word elderly or old or older adults, it will find the article. It also provides subheadings under the mesh title. So the word will have subheadings, and these subheadings will help you either to expand or narrow down your search to find the answer to your question. So if you go to the again, the PubMed website, you will see here the mesh database. You need to click on the mesh database to see what are the words that are used to index your topic. So if we click on this, you will get to the mesh database. So if I put in the mesh database, I put the word rheumatoid arthritis, then I will see that rheumatoid arthritis is one of the mesh words. So it is here. So PubMed is recognizing rheumatoid arthritis as a mesh word. If I click on this, I will see, let me go to show you what you're going to see, and then we'll go back to the question. So rheumatoid arthritis, here is the definition: a chronic systemic disease, So this is the definition. So it is a mesh title. If you look here, you will see the subheadings under rheumatoid arthritis. So you can narrow down your search to only the history, to the immunology, to the metabolism, microbiology, mortality rate, nursing, and so on. So these subheadings will help you expand or narrow down your search. So let me go back to the previous slide, which has the question. For example, if you have a question that says you have a patient, a 58-year-old man diagnosed with rheumatoid arthritis, and you don't know if what is more effective for pain relief, aquatic therapy or land-based exercise. Shall I give this person hydrotherapy or aquatic therapy, or I give him exercise on land? Clinicians might say aquatic therapy is better, but is it more effective? That's the question. Is it more effective to relieve pain? So the search words: rheumatoid arthritis, aquatic, and exercise. These are the important concepts that I want to capture to answer my question. So again, we found out that rheumatoid arthritis is a mesh word, so that's good. Let's look for the other words. Aquatic is the other word. If I enter aquatic, I will see that PubMed indexed everything under aquatic that is related to marine biology, aquatic ecology, aquatic organisms, aquatic organism. So they are talking about things that has nothing to do with physical therapy. They're talking about marine biology or creatures that are living in the water. So it has nothing to do with physical therapy. So maybe the word aquatic is not the best word to use in the mesh heading, because it is not giving me any information here about physical therapy. If I use the word water, which is another word for aquatic, I will see that also water doesn't help me. It is talking about water biology, different types of water, body water, protein in water, and so on. So this is not physical therapy. This is not what I'm looking for. It's chemical water pollutions and so on. These are not the things that I'm looking for. So the word aquatic did not help me. The word water did not help me. How about the word hydrotherapy? If I put the word hydrotherapy, remember we are still under mesh. If I put the word hydrotherapy, I'll see that hydrotherapy is there. So if I click on hydrotherapy, I'll see that hydrotherapy is a mesh word. It is defined. It is the external application of water for therapeutic purposes. So that's exactly what I'm looking for. You will see under hydrotherapy that there are subheadings, many subheadings. So I can narrow down my search or expand my search. So hydrotherapy is the word that is going to be useful. Exercise therapy is also a mesh word. Remember, I don't want to use just exercise because exercise can mean so many things. I want to use exercise therapy. So I clicked exercise therapy and it is a mesh word, and it has a definition and it has subheadings. So that is helpful. I can also use what is called filters. And filters are ways to narrow down my search even further. If you look at the PubMed website, you will see on the left-hand side that there are some options here. So because my search is arthritis, rheumatoid, and hydrotherapy, and exercise therapy, I really want the studies that are dealing with humans. So I clicked on humans. I want the studies that are only in English. So I clicked on English. And I want the studies that are done on males, not females. So when I narrowed down my search to only mesh words, and I used filters to narrow down my search even further, I ended up with only 3 studies. Can I handle 3 studies? Of course I can handle 3 studies. So 3 citations. What kind of citations? Let's read the first one. A pragmatic, randomized controlled trial of hydrotherapy and land exercise on overall well-being and the quality of life in rheumatoid arthritis. Remember, randomized controlled trial is on top of the hierarchy of evidence. So this is an excellent source of information. It even has a free article, so you can actually get the full article, the full text, so you can download the full text. So this search, when I searched this way, I ended up with the best evidence, and I ended up with a number that is manageable. I can read these 3 articles and will give me the answer to my question without wasting my time or looking into hundreds and thousands of articles. Okay? So the filters will help me narrow down human studies and not look in animal studies. For some searches, maybe you want to look at animal studies. For others, maybe you want to look at human studies. Now, physical therapists are working with horses. So maybe if you are treating a horse, maybe you want to look for animal studies. But if you're treating patients, humans, maybe you want to look only for human studies. I usually look for English because really it doesn't help me to give me an article in German. I will not understand it. The age range is extremely important because if you're looking for children, there is no reason to get the articles on adults. Gender is extremely important in many conditions. You need to look for women or men. Okay? I can also search PubMed by the author name or the journal name. If you know somebody and you want to get an article, a specific article for somebody, or you know a specific journal that you're looking for, you can also use the name of the author. For example, if I put Perry, Jacqueline Perry, who was my advisor for my PhD, I put her name, last name first, and then her first name. So Perry is the last name, Perry Jacqueline. Don't use punctuations, don't use commas, don't use and, don't use anything. Just the last name. You can use just J, but it will give you more citations. But if you specify Jacqueline, because it could be Jack, it could be something else, then it will give you the citation. So I got 15 articles. But if I want her articles that are published in a specific journal, I can say Jacqueline Perry and Journal of Spinal Cord Medicine. So I got 4 articles that are published in that journal. So this is another way of looking for citations if you know a specific author and you want to look for an article. Another way to look for studies on PubMed is called the clinical queries. And clinical queries are very helpful if you have a clinical question. So it includes all the studies that are pertaining to specific conditions or diseases. It adds terms that focus the research or your research on the most useful forms of evidence for the clinic. So clinical queries are right here on the website. So you can click on that and do the same thing and look for your answers. All right, I think I gave you a lot this time. Please, after you listen to the lecture, please try to practice with PubMed and practice in different ways and use the mesh headings and see if you can succeed in narrowing down your the answer to your questions. I'm not going to give you homework this time because you are still working on your assignment from last time. I wish you the best and I will talk to you again next week. Salam alaikum.